leading health organisations are sounding the alarm this May 2026 as hantavirus activity reaches levels described by some experts as a significant public health shift. The focal point of international concern is currently centred on the South Atlantic, where an outbreak aboard the cruise ship MV Hondius has triggered a multi-country response involving the World Health Organization and the European Centre for Disease Prevention and Control. Reports indicate that the vessel, which departed from Ushuaia, Argentina, on April 1, has become the site of a cluster of severe respiratory illnesses. As of the second week of May, official data confirms 8 cases, including 3 fatalities, with the victims showing a rapid progression from initial flu-like symptoms to acute respiratory distress. This surge is not an isolated maritime incident. In mainland Argentina, health officials report that infections have nearly doubled over the past year. Statistics from the Argentine Ministry of Health reveal that the current season, which began in June 2025, has already seen 101 confirmed cases and over 30 deaths, a sharp increase from the 57 cases recorded during the same period in the previous year. Scientists and infectious disease specialists are increasingly pointing to what they characterise as a climate catastrophe as the primary driver behind this escalation. +5 The underlying mechanism for this spike involves the ecological response of rodent reservoirs to shifting weather patterns. Hantaviruses are a family of viruses spread mainly by rodents, including the long-tailed mouse common in South America. Under normal conditions, these viruses remain largely hidden within rural ecosystems. However, experts explain that rising global temperatures and extreme weather phenomena, such as prolonged droughts followed by intense rainfall, are fundamentally altering these habitats. These conditions can trigger masting events, where an overabundance of seeds and fruits provides a massive food source for rodents, leading to a population explosion. As rodent numbers swell, they increasingly encroach upon human settlements and tourist infrastructures in search of resources. Furthermore, habitat destruction and the establishment of small urban developments in previously wild areas have narrowed the buffer between humans and the virus. This proximity increases the likelihood of humans coming into contact with aerosolized viral particles found in rodent urine, feces, or saliva, the primary route of infection. While hantavirus is rare, its high fatality rate, which can reach nearly 40% in certain strains, makes this climate-driven expansion a top priority for global surveillance. Public health reporting now suggests that cases are appearing outside of historically endemic areas, challenging previous assumptions about the geographical limits of the virus and requiring a broader, more vigilant approach to diagnostic testing and environmental management. The investigation into the MV Hondius outbreak has mobilised a complex international network of laboratories and health agencies, highlighting the logistical challenges of managing a highly lethal pathogen in transit. The ship's itinerary, which included stops in remote regions such as the Antarctic mainland, South Georgia and St. Helena, has complicated the task of pinpointing the exact source of exposure. According to the World Health Organization, the first symptomatic passenger was reported on April 6, shortly after the vessel left Argentina. The patient's condition deteriorated rapidly, leading to death on board on April 11. Subsequent cases emerged among close contacts, including a female passenger who went ashore at St. Helena and another male passenger who was medically evacuated from Ascension Island to a specialised intensive care unit in South Africa. It was at the National Institute for Communicable Diseases in South Africa that polymerase chain reaction, or PCR, testing confirmed the presence of hantavirus on May 2. This laboratory confirmation was critical, as it allowed health officials to narrow their focus to the specific viral species involved. +2 genetic sequencing and metagenomic analysis are currently ongoing to determine if the strain is the Andes virus, a particularly concerning species of hantavirus native to South America. Unlike most other hantaviruses, which are exclusively zoonotic, the Andes strain has been documented in previous outbreaks to be capable of limited person-to-person transmission through close and prolonged contact. This possibility has elevated the risk assessment for the 147 passengers and crew members still on board as the ship moors off the coast of Cabo Verde. The WHO and ECDC are contrasting verified laboratory data with suspected cases to map the transmission chain. Currently, 5 individuals remain under investigation, with symptoms ranging from high fever to gastrointestinal distress. The clinical progression of the disease remains a primary focus for medical teams. Infected individuals typically endure an incubation period of 1 to 6 weeks, followed by a prodromal phase of fever, muscle aches, and dizziness. In cases of hantavirus pulmonary syndrome, the disease then shifts abruptly to a respiratory phase where the virus triggers immune dysregulation. This causes the vascular system to become permeable, leading to a rapid leakage of plasma into the lungs. This process, rather than direct viral destruction of tissue, results in the pulmonary edema and cardiovascular collapse seen in the most severe cases. Regional health ministries in Chile and Argentina are also reporting increased pressure on local clinics, as the rise in rural infections necessitates specialized supportive care, including mechanical ventilation and extracorporeal membrane oxygenation, in the absence of a specific antiviral cure. As the international community grapples with the current surge, public health guidance has been updated to reflect the evolving risks of rodent-borne diseases in a changing climate. The European Centre for Disease Prevention and Control has published strict management protocols for passengers potentially exposed to the Andes hantavirus, emphasising that even those without symptoms are to be considered high-risk contacts. The guidance dictates that repatriation must occur via specially arranged transport rather than commercial flights, with mandatory self-quarantine and vigilant monitoring for up to 6 weeks. For the general public, prevention remains centred on environmental control and safe cleaning practices. Health officials stress the importance of sealing gaps in homes and storage buildings to prevent rodent entry and securing food sources in airtight containers. When cleaning areas where rodents may have been present, such as cabins, barns, or sheds that have been closed for the season, the primary directive is to avoid stirring up dust. Instead of dry sweeping or vacuuming, which can aerosolize viral particles, the use of a 10% bleach solution or a commercial disinfectant is recommended to thoroughly wet, contaminated areas before cleanup. +1 significant uncertainties remain regarding the long-term trajectory of hantavirus activity. While the current cruise ship cluster is being contained, the broader trend of rising infections in South America suggests that the ecological factors driving these outbreaks are not easily reversed. Scientists are working to refine predictive models that link climate data with rodent population cycles to provide earlier warnings for at-risk communities. However, there are limits to current knowledge. The exact threshold of environmental change required to trigger an outbreak remains a subject of intense study, and the development of a widely available vaccine is still in the research stages. Public health agencies continue to emphasise that while the risk to the general global population is currently assessed as low, the severity of the disease necessitates a cautious and informed response. Surveillance programs are being expanded to monitor rodent populations more closely in suburban and recreational areas that were previously considered low risk. For now, the focus remains on early detection and the implementation of robust infection control measures to prevent localized clusters from expanding. Authorities urge anyone who has travelled to endemic regions or had potential rodent exposure and subsequently develops a high fever or difficulty breathing to seek medical evaluation immediately, noting that early supportive care is the only effective means of improving patient outcomes. For more updates on global health reporting and infectious disease surveillance, consider subscribing to this channel. The core of the international response to the increasing frequency of hantavirus cases is currently being managed through a high-level collaboration between the World Health Organization, the Centers for Disease Control and Prevention, and regional health ministries across the Americas and Eurasia. These agencies are shifting their focus toward genomic surveillance, a process that involves sequencing the viral RNA found in both human cases and rodent reservoirs to track how the virus may be mutating or expanding into new territories. Laboratory testing remains the definitive hurdle in managing these outbreaks, as the initial symptoms of hantavirus, high fever, muscle aches, and fatigue, are nearly identical to those of more common viral illnesses. To provide a definitive diagnosis, specialized labs utilize a dual-track testing protocol. First, they look for viral genetic material through reverse transcription polymerase chain reaction, or RT-PCR, which can identify the presence of the virus even in small quantities during the early symptomatic phase. Second, serological testing, specifically enzyme-linked immunosorbent assays or ELISA, is used to detect the presence of IgM and IgG antibodies. This identifies whether an individual is currently fighting the infection or has been exposed in the past, allowing epidemiologists to map the true footprint of an outbreak beyond just the patients who reach the hospital. A major point of investigation for health officials is the direct link between what scientists are calling a climate catastrophe and the recorded surge in rodent activity. In endemic regions, particularly in the Pacific Northwest of the United States and the southern cone of South America, researchers have documented a significant shift in ecological stability. The mechanism at work is tied to the frequency of masting events, an ecological phenomenon where trees and shrubs produce an overwhelming abundance of seeds. In a stable climate, these events occur every few years, but erratic weather patterns, including unseasonable warmth and cycles of extreme drought followed by intense rainfall, have triggered these events more frequently. This provides an almost limitless food supply for rodent carriers, such as the deer mouse and the long-tailed pygmy rice rat. The result is a population explosion that persists through the winter months. As these rodent populations surge, they naturally expand their territory into human-occupied spaces. This leads to a higher concentration of viral shed in the environment, primarily through aerosolized urine and droppings, which humans then inhale while cleaning or working in rural and suburban settings. While official reports from agencies like the European Centre for Disease Prevention and Control maintain a calm posture, they are contrasting their verified data against increasingly alarming claims of a global shift in hantavirus behavior. Current scientific consensus holds that while the virus is becoming more active due to environmental stresses, there is no verified evidence that the virus itself has become more easily transmissible between humans, a concern that often surfaces during high-profile outbreaks. Most hantaviruses, including the Sin nombre and Sol strains, remain strictly zoonotic. The rare exception is the Andes virus in South America, which has shown a limited capacity for person-to-person transmission in very specific close contact scenarios. For healthcare providers in the field, the clinical development of the disease remains the primary concern. Once a patient enters the pulmonary phase, the mortality rate is often cited as being between 35% and 40%. Hospitals are reporting that the most effective, albeit intensive, intervention is the use of extracorporeal membrane oxygenation, or ECMO. This specialized equipment acts as an artificial lung, oxygenating the blood outside the body to give the patient's own lungs time to recover from the severe inflammatory response triggered by the virus. However, the limited availability of such technology in rural areas where these infections often occur highlights a significant gap in global health infrastructure. As the global community faces the reality of a more active and geographically unpredictable hantavirus landscape in 2026, public health guidance has shifted from reactive treatment toward proactive environmental management and sophisticated surveillance. The primary defense against hantavirus pulmonary syndrome remains the physical exclusion of rodent reservoirs from human dwellings and workspaces. Health agencies are issuing updated protocols for structural mitigation, emphasizing that any opening larger than 1/4 of an inch, roughly the width of a pencil, must be sealed with durable materials such as steel wool, hardware cloth, or cement. This is particularly critical in rural settings, seasonal cabins, and shipping facilities where rodent activity is most prevalent. Officials stress that managing food sources is equally vital. All pet food, birdseed, and human provisions should be stored in thick plastic or metal containers with tight-fitting lids. By removing the incentives for rodents to enter human environments, the statistical likelihood of viral shedding in close proximity to people is significantly reduced. A critical takeaway for the public involves the specific, non-negotiable protocols for cleaning areas where rodents may have been present. Standard cleaning methods, such as sweeping or vacuuming, are strictly discouraged by the World Health Organization and the CDC because these actions stir up dust and create the very aerosols that carry the virus into the human respiratory system. Instead, the standard procedure is the wet method. This requires thoroughly soaking any suspected nests, droppings, or contaminated surfaces with a disinfectant, ideally a solution of 1 part bleach to 9 parts water, and allowing it to sit for at least 5 minutes before wiping it up with paper towels or rags. For individuals working in high-risk environments, such as enclosed barns or crawl spaces, the use of personal protective equipment, including gloves and N95 or P100 respirators, is now considered a standard safety requirement rather than a suggestion. These practical steps, while seemingly basic, are the most effective tools currently available to prevent the catastrophic immune response triggered by the virus. On the level of international surveillance, health organizations are increasingly adopting a One Health approach, which integrates human, animal, and environmental data to predict future outbreaks. By monitoring the masting cycles of trees and correlating them with satellite-derived climate data, scientists hope to provide localized warnings to communities several months before a rodent population explosion occurs. However, significant gaps in knowledge remain. The threshold at which climate-driven ecological shifts become irreversible hotspots for hantavirus is still a subject of intense academic debate. Furthermore, while research into hantavirus vaccines continues, there is currently no globally approved immunization for the most lethal strains. This leaves public education and early clinical intervention as the only viable lines of defense. The ethical dimension of this reporting highlights a growing consensus as human activity continues to alter the global climate. The resulting displacement of wildlife creates new points of contact for ancient pathogens. Public health reporting indicates that the current surge is not merely a biological anomaly, but a symptom of a broader environmental transition. The limits of current medical technology mean that we cannot simply medicate our way out of these emerging threats. Instead, safety depends on a combination of rigorous hygiene, ecological awareness, and international cooperation in data sharing. As the situation aboard the MV Hondius and the rise in Argentine cases demonstrate, viral threats do not respect borders or itineraries. The responsibility for prevention is shared between the individual, who must maintain a rodent-free environment, and the state, which must fund the surveillance necessary to catch the next cluster before it expands. We remain in a period of high vigilance as the 2026 season continues, with health officials monitoring for any further signs of geographic expansion or changes in viral behaviour. For continued coverage of global health developments and investigative reporting on emerging pathogens, consider subscribing to this channel.